Hey, everybody, welcome to our Facebook Live and to our discussion on health and wellness, which is a big consideration for all of us, especially during this time in history. Last week, we focused on the new normal, a new paradigm for a new era of medicine. We drilled down in our discussion to explore the wellness revolution. And today, we're going to talk about preparing moms and the world for Generation Alpha. And this is a medical perspective. We live in a world that we talk about that's tried and true. If we tried it and it worked, then it's true that it will work for everyone in every generation. But we have discovered that that statement in and of itself is not true. The world into which we were born no longer exists. And this current medical crisis has proven that we need to rethink and examine every industry, especially our health and wellness industry. And today we have with us Dr. Paula Walker King, board certified physician and author, as well as Dr. Lori Johnson, board certified OBGYN, and Dr. Chandra Jones, also board certified OBGYN, to talk about where we are and how we can prepare as mothers for this new health challenge that we are facing. Welcome, doctors.
Thank you.
Thank you. Thank you for having us.
You're welcome. I want to jump right into our discussion.
Thank you.
You, Dr. Jones, you work in the epicenter of COVID pandemic in New York City. And we know that being a city that has really been hard hit, you have a frontline expertise on the effects of COVID on pregnant women and their unborn babies. Please share with us your experience.
Thank you, Dr. Trimm. And it's such an honor to be a part of your organization and your team. I thank my co-sisters as well. COVID hit us very, very hard. And it hit us at a time where we were unprepared. One thing about being in New York City in the epicenter is that our governor was one who rallied the cause early. When we first started seeing patients, we just thought it was the common flu. And each year, we know there are thousands of people who die from the flu. But this year, there was something particular about this strain. Now, we talk about COVID virus and we talk about the coronavirus. I just want to take a back step for a minute. The coronavirus has been with us for centuries. There are 7 types of coronaviruses, and there are 4 that affect the human race. Now, out of these 4, COVID-19 was first discovered in 2019, thus the name COVID-19. Now, what makes COVID-19 so difficult is that it is very contagious. It is more contagious than any of our infectious diseases that we've seen thus far. Now, this virus, as we know, can be spread easily by droplets. It can also be spread by the fecal-oral route. Now, pregnancy is a certain time when a woman, in order for her to maintain the pregnancy, her body has to suppress her own immune system. Now, can you imagine you already have a very infectious virus and you have a host with an already suppressed immune system? That is a recipe for disaster. And that's what we have been noticing here up in New York. Early on, we saw a lot of ladies come in with high fevers of unknown etiology because we didn't know what the cause was. Not only did we not know the cause, we didn't even have a test to identify what we were seeing in the population. So we started seeing a lot of patients come in with fevers that were out of the norm. Normally, whenever your body gets sick, you have a fever. Our body is such an incredible engine. It will rev up to the attack, and it revs up by increasing your temperature. And we know if you put enough heat to anything, it's going to kill it. So we first started noticing that these ladies would be coming in with high fevers. However, the host response, the white blood cells that our body uses to kill infections, were low. And we could not figure out exactly what was this cause. So what we did is we tried to put a Band-Aid to an open wound. We just started giving supportive therapy. By supportive therapy, we did the best we could. All we did was to decrease the temperature. We would treat the symptoms, like when your body is overwhelmed with infection, you
Mhm.
can't breathe because basically your fluids are taking over your body. And if you can imagine having fluid in your lungs,
Mm,
air can't be there.
mm,
So the first thing we were seeing is these people were coming in, they were hypoxic. That means low oxygen count. And when your oxygen is low, the only thing that you can do is intubate. And that is give yourself enough time so that your body can recover and heal. So that's what we started seeing. We started seeing young pregnant women who were normally healthy otherwise coming down with this infection, and they were having to go on intubators just in order to save their lives. Now in New York, we had, like I said, our governor was really on top of situations. My hospital, I work in one of the inner city hospitals, and they turned our hospital into ground zero for COVID. They took all of the normal patients that we have in the hospital, patients that have like heart attacks and are recovering from strokes and other medical conditions. They shipped them to other hospitals, making my hospital ground zero. So it was for me very exciting because I'm a maternal fetal medicine specialist. I deal with high risk pregnant patients, and infections have always been one of my passions. So for me to be able to be one of the thought leaders and bring in thought processes and help lead my team forward, it was nothing but the Lord. And I don't want to take up all the time because Dr. Trimm, I can go on and on about some of the cases that we've seen here in New York, but I'm happy to say that right now we are turning the corner. We are getting better. My hospital is recovering. We're seeing a lot of patients who normally would have died go home to their families.
it's the
And
sun.
along the way, we lost some of my healthcare colleagues to this treacherous virus.
Mm,
So I just want to give a little shout out right now. I see what's going on in the world and in the country, and social distance is the key. That's what saved New York City. And I see now with a lot of things that are going on in the United States, and I don't want to jump in to other areas that, you probably was distance work. It
mhm.
works for a reason, and it's here to help save lives. So I thank you, Dr. Trimm, for this platform. I thank my colleagues. I will let them speak now because I can go on and on because I'm so passionate about my work and what we're doing here in New York. But more importantly, I just thank you, Dr. Trimm, for allowing me this opportunity and this forum to let my voice be heard.
Dr. Chandra, thank you so much. We can hear your passion. Dr. Lloyd, you have a passion too for what you do, and this is why we invited you onto this discussion. You've worked in both Pennsylvania and Georgia after graduating from Johns Hopkins, Drexel University, and you did your residency at Lehigh Valley Hospital.
Yes.
And over the years, you have personally
You
experienced have experience with high risk pregnancy, and you've spent your own share of fetal complications. So can you talk to us about how some of these risks can actually be avoided
in regard to COVID or just in general?
in general,
Well,
with especially with pregnant mothers?
well, I think one of the main things that people tend to forget when it comes to pregnancy is that the most important time to ensure healthy pregnancy is really before you get pregnant. And a lot of people come into pregnancy, especially in our community, in our culture, with a lot of conditions that they have not been treating properly. So they may be overweight, they may be obese, they may have hypertension, they may have pre-diabetic conditions prior to getting pregnant. Then when you add this pregnancy on top of whatever they already have going on, then you have like this whole conundrum of situations, because you always, once you're pregnant, you have two patients, the mom and the baby. And so one of the things I really try to impress upon my clients, if I can see them before they get pregnant, is to maximize their health prior to the pregnancy. make sure they're taking their medications, make sure their sugars are in check, because once they're pregnant, now we have to try to get them to this finish line of a healthy mom and a healthy baby, when we didn't come in such a great fashion. So that's one of the things I see a lot, especially in our community, and that some of that is just um, lack of education and information. But then there are other things that have to do with like the social processes. For instance, in Georgia, the medical system is very hard to access. So there are women who may have chronic conditions, but when they're not pregnant, about 6 to 8 weeks after pregnancy, they will lose their health coverage. They'll lose their Medicaid coverage. So then they can't necessarily afford their medications. They can't really maintain it. And the next time they can get Medicaid is when they're pregnant the next time. So now we have to play catch up for the past year, the past 2 years, because they haven't had any care in the meantime. And now we're trying to get everything situated, try to get it all done once they get pregnant. So those are things that we have to do better. And I try to make everybody aware of that, as far as our voting processes and things like that, because when we have these people in power who want to pull back on the funding for those programs, Medicaid programs, and things of that nature, that puts our moms and our babies at risk, because you're going to have worse outcomes. And you may have heard that Georgia is one of the worst states in the country for maternal mortality. So we're losing moms here in Georgia like worse than some third world countries. And a lot of that, I believe, is that piece of it. Once these ladies are no longer pregnant, they have nothing. And they're just out here trying to figure out how to pay for this medicine or pay for that. And so they come back pregnant and their blood pressure is already out of control. So we have to do better in teaching and informing our moms. And that's how you lower the risk. You get a healthy pregnancy when you have a healthier mom that comes into the pregnancy.
Mm-hmm. And you're talking about health disparity, huge conversation. Yeah. So in my mind and in your mind, and this is a question for the whole three of you, what do you envision for the future healthcare system?
I just want to second on what Dr. Lori just said in terms of, these access issues and some of these social determinants of health. When it comes to, the economics disparities that exist between communities and different demographics among our populations, it is problematic. And that's why, in addition to seeing heightened maternal mortality rates in the state of Georgia, and even in the United States in general, we also see, these heightened and worse outcomes in patients with COVID-19 among African Americans and Hispanic communities. And again, it all goes back to the same drivers, these socioeconomic determinants and these socio-contextual factors that must be addressed, head on. And so when I envision this, the healthcare system, for years, Dr. Trimm, I thought it was a fractured system. In fact, I preached that, I taught that. I said, our healthcare system is broken and we really need to, examine where the fissures and the fractures are. But the more I evolve in my thinking, involve in my experiences, I have come to realize that the United States, being a country built on racial caste, that this is really, the healthcare system is functioning as it has been designed, meaning that those that are poor will get, not as quality care as those that are more socially advantaged and more economically advantaged. And so we have to begin to re-engineer the healthcare system, because it started with these disparities. It started with these uneven outcomes, this unequal treatment, which has been well documented by the Institute of Medicine. So in order to begin to call forth a better future, a brighter future for the American healthcare system, we really need to collapse the existing design of the system and really resurrect something anew that takes into consideration marginalized populations as well, and not just let them get in where they fit in. And a lot of them don't fit in. They're not any avenues for access for individuals from a lot of minority groups. And so we really have to redesign a healthcare system where there are policies that are put in place that will allow for the mitigation of these existing gaps and allow for greater access, allow for greater preventive care, a lot of more preventive screenings to be put in place so that these chronic diseases, we don't see the advancement of pathology that has been associated with most chronic illnesses.
I see you agreeing, Dr. Chandra.
Yes. And my sister Paula is so right. We need to get back to, as my mother would say, ounce of prevention is worth a pound of cure. We need to get back into a preventive mode. Right now, we are operating in a hazard zone. Everything is going, everybody at this point with the new disease process, everybody is fending for themselves. And it's almost like it's the design of the fittest. The medical team, we haven't really caught up with exactly what's going on. This disease has been with us for approximately 4 months. And everybody has their anecdotal. I
think we're frozen here. I'm going to give you an opportunity just to fix that. Dr. Lori, you want to weigh in?
Absolutely. I think, as Dr. Walker said, it just needs a complete overhaul. Right now, we've not been able to, unfortunately, it's based on money, ability to pay, and capitalism, but we need to overhaul it in some form or fashion that allows people across the board to have access to good care. Because right now, it's just not that situation. And it's unfortunate, and as we're saying, as she said, with the COVID, why African Americans are dying in higher numbers goes back to those underlying conditions, goes back to people not having insurance, goes back to people getting better medication versus less medication. And then goes back to, even if we create a new system, ensuring that the doctors buy into it. Because when the Affordable Care Act came about a few years back, there were particular brands of insurance that were under the ACA, but many doctors don't participate. So you have these patients who get this type of insurance, and there's nowhere for them to go. They follow the rules, but doctors aren't participating by choice, because on the other side, they make it so complicated and so difficult for the physician to get paid, et cetera, et cetera. So now you have insurance and you can't use it anywhere. So you might as well not even have it if that's going to be the situation. So we have to really look at all the pieces of the puzzle. And I think that to date, we've looked at maybe a piece of the puzzle or a piece of the pie, and no one's taken a step back and looked at the entire pie and tried to fix the pie as a whole.
Yeah, I like your metaphor that you're using, when we talk about it being like pieces of puzzles that you fit together. And over the past few weeks, we've had many conversations on, how you're handling, your colleagues are handling the challenge. But so many people are now stressed out. And, there's so many stressors. So what is the stress hormone? And what does it do to our bodies?
Well, the main stress hormone is cortisol, and that's in our adrenal glands. And so your adrenal glands are these small glands that sit on top of the kidneys, and they kind of maintain our bodies through times of stress. So the cortisol is kind of what keeps you up after you've been up all night, and kind of gives you that fight or flight reaction and response. So, but after a while, you get taxed. So you get belly fat, cause belly weight gain, belly fat, hair changes, all those types of things, because we're chronically stressed. In the short term, it can cause rapid heartbeat, sweating, things of that nature, because you're constantly running on this excess hormone, just trying to kind of keep your head above water. But it can cause a lot of long-term effects, long-term chronic effects, just like all stress can. And so we have to really remember to take a step back. I know for myself, the past 3 or 4 days, I've kind of stepped back social media because it's a lot of things going on, and every now and then you have to do that to maintain your own mental sanity. Dr. Walker, what do you think?
Yeah, I just wanted to, yeah, I totally agree with Dr. Lori. I describe it when you think about holding a small cell phone, which is only a few ounces. If you pick up your cell phone and you put it back down, no problem. But if you pick up your cell phone and then you hold it for several days, your arm is going to get tired. Well, it's the same thing happens when we're under stress. That cortisol, that main stress hormone, and adrenaline, those hormones are released and they cause rapid heart rate, as Dr. Lori said, elevated blood pressure, and it causes our bodies to be up in this revved up state. What happens over the long term, what we call allostatic load in stress physiology, is that long-term stress, it causes wear and tear on the compensatory mechanisms of the body. And so now your heart rate, if you're chronically stressed, your heart rate is always elevated. Your blood pressure is always elevated. The digestive system, doesn't work as efficiently when we are in fight or flight mode. And so all of these things, like Dr. Lori said, can cause us to gain weight. It can cause headaches. It can cause heart disease. It can predispose us to having problems with memory and concentration, and have other mood disturbances. It can interfere with our sleep. We can have insomnia. So there are a lot of somatic problems and complaints that can arise from just being chronically stressed. Now, I mention all of that because it goes right back to those health disparities. When we look at health disparities, guess what? When we start to peel back and say, what is the underlying trigger? What is the common denominator of these health disparities? And stress. The stress biology comes into play. We see that when we look at some of the socio-contextual factors like lower socioeconomic status, lack of insurance, poverty, these social and socio-cultural factors that predispose us to chronic illnesses. Chronic stress is a driver. It's one of the common drivers of all of these illnesses, because if you're having to worry about how you're going to make ends meet, you're having to worry about food insecurity, housing insecurity. All of these factors cause us to live stressed out lives. And as a result of stressed out lives, then we are more prone to develop some of these chronic illnesses. And consequently, we're more prone to having worse outcomes when it comes to some of these illnesses. So all of it's connected. None of these are occurring in isolation. It's all connected.
Yes. There are two other generations that are emerging, and that's the Z and Alpha generation, or Gen Z and Alpha generation, two new generations. So the world into which we were born no longer exists. How do we raise our level of consciousness to include the wellness revolution for us and for future generations? I know that's a long question, but just to restate it, we have generations coming behind us. How do we actually raise that level of consciousness to include the wellness revolution for us and for future generations?
I think it's starting, actually. I think we've become a lot more health conscious. I see a lot of younger people they're going more toward the vegan lifestyle, going more toward paying attention to what they put into their bodies, which I think is an amazing start to the revolution, if you will. I think that we have got to start earlier with the younger children, teaching them about how to eat, what to eat, and taking better care of themselves. A lot of that's going to be in education from the millennials and their children on. But I think we're starting to see it. It's just not as widespread as it probably should be, or as it will be. But we're starting to see some of those changes. I hope that the medical establishment can participate in those changes, and fix some of the distrust that they have, the medical system has currently, by participating with health educators and the younger generation to push forward that agenda of wellness, because I think that really needs to happen.
Dr. Walker. Big question. And I'm going to get you to weigh in on something specific, and I'm throwing it out to everyone. Veganism, vegetarianism, and carnivores. Weigh in, please, when it comes to health.
Well, what we know for a fact is in terms of, optimizing our health and our experience of wellness, the more our diet has what we call a plant slanted toward the plants. And what I mean by that, fruits, vegetables, grains, those things that come from the earth, the greater our health will be, the greater our experience of wellness will be. And so increasing, and we need at least 5 servings of fruits and vegetables. And so I always say 5 keeps me alive. So you need to say minimum, you got to have 5 servings of fruits and vegetables
Okay, so
every single
fruit and diabetes. What
Okay, so
does a diabetic do leaning toward a plant-based diet? Some of the fruits are just cannot be a part of their diet.
I'm glad you brought that up. So with the diabetic, so we have to then slant it, we have to switch it, flip it. So then the diabetic needs more vegetables versus fruits. So fruits have a naturally occurring sugar in them called fructose, and that will raise blood sugars just as rapidly as if they had the Oreo cookies or the Krispy Kreme. And so they still have to watch their carbohydrate intake. They have to watch their intake of overall sugars. And so for diabetics, I do make, you have to make an accommodation or concession where they have to just consume more vegetables and really watch their fruit intake. And so as to keep their blood sugars levels within normal limits. And that's something that they should be monitoring every single day. But for those that are otherwise healthy, then you're getting 5 servings and fruits and vegetables. And I still say that it's probably a good rule of thumb for most to aim toward having more vegetables as opposed to fruits, because we get so many other sugars in our diet anyway, by way of some beverages, some of, the carbohydrates that we consume on a regular basis. And so when we look at most people's diets, most people are deficient in vegetable intake. And one easy way, Dr. Trimm, to increase one's vegetable intake is just to commit to having a salad a day. I mean, if you commit to a salad a day, you have some romaine and radicchio lettuces, and then you throw in some tomatoes and some onions,
And some
maybe
cucumbers.
slices of apples, maybe sprinkle it with some walnuts. I mean, you're getting some healthy vegetables there, along with some other healthy protein, meaning the nuts or the seeds that you choose to put in the salad. And then you can drizzle it with some light vinaigrette, some olive oil based dressing, and you get your healthy serving of vegetables. And so it's very important that we need to have mostly a plant-based diet, having more vegetables, more grains, more fruits in our diet in terms of vegetarianism, veganism, or whether you choose to be a carnivore, you've got to really limit the limit the meat intake, because we do see correlations with higher consumption of meat and the risk for cardiovascular disease over time. But those that have mostly plant-based diets, we see when we look at our centenarians, look at longevity studies, most of them have plant-based diets, even those blue zones that we talked about during previous broadcasts, where these people live healthier lives and they live longer lives. Most of them have a diet that is rich, replete with vegetables.
Wonderful, wonderful. Can you believe our time is almost up? So as we're winding this, I can't believe it. But as we're winding out for now, that is, and there's so much more that we're going to talk about in the future. But as we're winding out, talk to women. How can women not only take care of themselves during this pandemic time, but post-pandemic? How do women and how should women take care of themselves and then take care of their babies and their toddlers?
Well, I think one thing obviously is seeking out the care. If you're pregnant during this time, this is n- not the time to stop going to your doctor. Um, being very careful with social distancing and being careful with everyone that you're around and who's coming into your space. It's not enough for you to just stay home. It's important that anyone that you encounter with is functioning in the same way. So if that person you talk to is always outside, going here, going there, in the midst of this pandemic, that's an individual that should not come to your house because you don't know who all they've encountered. And so once maintaining those things and taking your vitamins, doing all the things normally, but again, staying away from people is the best way to prevent getting this virus and being affected. I know we want to get our hair and nails and all those things done, but at this point in time, it's just not safe enough to do that. And same thing with the babies and the children, keeping them away. Babies touch things, they touch everything. They're all over the place. The best thing to do is to keep them at home, keep them with you, take them in your yard, but don't have a lot of playdates. Don't have a lot of different people coming around the children in now in post pandemic. We've cut the hospital visitation down to pretty much one person for the entire time. You kind of want to maintain that once you go home. You don't want the whole neighborhood and all your family and cousins coming to see the baby right after you get home, because that too, they're bringing everyone that they've been in contact with to your home and to your new baby. So until we have some real light at the end of this tunnel and some real flattening and going away, the thing is to just really stay in, drink your water, eat your vegetables, everything you've been doing, but really just stay home.
Yes. Thank you so much. Dr. Walker, you have the final word.
As it relates to the women, I think women, first of all, whether they're new moms, whether they're established moms, we just have to take care of ourselves. And the main thing is to know that it's not selfish if we carve out me time to replenish our energies and to restore our energies. I think it's so very important that new moms as well as established moms have adequate support systems, so that in a strong social circle, close circle of people that they can rely on, that can assist them with some of their mom duties when needed, and then also make it possible for them to take breaks to make sure they're exercising, make sure they have adequate stress recovery, meaning meditation, time for prayer, time for walks in nature. So moms need to take care of themselves because they're constantly pouring out. They're constantly making deposits into their children, their spouses, their other loved ones. And the better we are at self-care and stress recovery, the more energized we'll feel and the better we will be in terms of serving and contributing to our households as well as the larger communities. And so take care of yourselves, Mom. That's the main thing. And make sure that you're eating well, sleeping well, hydrating well, and tending to that so much needed self-care.
Thank you. Thank you. So moms and those of you that are out there caring for everybody else, take so many moments, dance, laugh, do what you can to remove the stress. And then at the end of the day, know that there's a group of us out here that are rooting for all of you, and we're here for you. Stay safe, stay happy, and stay hydrated at this time. Protect yourself and protect your children. Dr. Lori, Dr. Paula, Dr. Chandra, we can see you. Thank you so much for carving out the time to be with us today. Until we meet again, goodbye for now. God bless.